Hello, I am Dr. Malea Jensen. Welcome to Dr. J's Prescription. I'm your host. This is Tucker, my co-host. He is co-hosting from heaven. So welcome. This is your opportunity to ask medical questions. That's what this platform is in regards to, is asking medical questions, having some back and forth dialogue, and helping you with information that might provide you better ability to make decisions in the future regarding your health. With that being said, I am a family practice physician. I've been in practice for about 27 years, and I am located in Des Moines, Iowa, in the United States. So where are you guys listening from? Let's hear from you. I have some, not housekeeping, but just some information. On your screen, you might note that I have a live fundraiser for rescue, rehab, and rehome. I'm trying to raise $100 for them. I have had a few people that have already donated, but if that interests you, even if it's $1, it would help. And I believe I have 10 days left on this particular live fundraiser. There's another thing that you'll see on your screen, and that's description. And basically that I believe is to show support for people you enjoy to watch on. I am live on Instagram and YouTube this morning. As a result, this is not medical advice. This is for information and entertainment only. I am a doctor, but you guys are not my patients. I appreciate all of you for taking that into consideration. Yesterday, we had a few questions that I'm not sure that I answered or answer as adequately as I could. So I went and did a little bit more research, looked some things up. One of those, I wrote it down. One of those came from a person who asked about blood sugars on a ketogenic diet. They said that ketones were in the 3 or 4, I'm going by memory here. I believe they were in 3 to 4 range, but yet blood sugar was sitting around 69. Do I think that's a problem? Only the patient was, or the person was having symptoms. This person particularly is not having any symptoms like lightheadedness or cravings for sugar, hunger, things like that. The ketogenic hypo, so a ketogenic diet is keto, carnivore, lion diet. Ketogenic hypoglycemia was first noticed by pediatricians back in the 1960s. Why? Because they were using ketogenic diets on their epilepsy pediatric patients. And they did note that some of these, not all, some of the children were having low blood sugars, maybe not enough to cause them to give blood sugar or to do anything about it because we're still actively playing and thinking and doing things. They weren't falling over. But there's something that you could look for, and this is where I'm glad that this person brought up the question on low blood sugars on a keto diet. And where do we look when that could be a problem? Thyroid. You see, when the thyroid is working well, okay, when the thyroid is working well, it's not hypothyroid, it's not underactive, it's overactive, it's working well. Our body will, in the presence of, on ketosis, our body will preferentially burn fat. So if we burn fat, we ketones. The only way we can burn fat is when insulin is low. So on a ketogenic diet, we're burning fat and we're getting result as a ketone. However, okay, when is not the case? When the thyroid is underactive. When the thyroid is underactive, we start going into an adrenaline, a cortisol, or a sympathetic type of reaction. Now, we're not burning fat because when anything sympathetic or anything cortisol or anything adrenaline-wise, epinephrine, we're going to raise blood sugar. When we raise blood sugar, we raise insulin. In the presence of insulin, we cannot burn fat. So we'll be burning not ketones, right? Be burning glucose. All right. Yes, if you were here when it first started, I introduced myself. Yes, I am a family physician located in Des Moines, Iowa. What do we got? Or more fat at that time. At what time? At what time? It's hard for me to just jump into your chat back and forth, you guys. If you have a question, put a Q in front of it or a QQ. Brandy says, when they're stressed, etc., being in a state of sympathetic overdrive, I believe what she's saying, our cortisol will go up. And that will raise blood sugar, and you do not have to be eating anything and your blood sugar can go up. So it could be fasting. A fast initially is a form of stress. So that simple fasting until your body gets used to it, so to speak, are going to adapt to anything, but initially it's going to be a stress. So no food is a stress. Anxious, it will cause blood sugars will rise, insulin will rise, fat will be laid down, not burnt. You cannot burn fat in the presence of high insulin. So good point, Brandy. Thank you. I appreciate that. So hopefully that answers the question to the gentleman today who asked about low blood sugars and on ketosis. It's interesting that how fast insulin can come about when cortisol is active. And it's amazing. So, yeah, that was one question I wanted to revisit this morning. The other question was in regards to bone health or bone strength. And yesterday we mentioned, resistance training. If we want to if we want to strengthen our bone, we want to do weighting exercises. Swimming is not a, isn't that's going to help with bone strength because it's not weight. You're buoyant, especially if you have fat, buoyant. When you put a droplet in water, it floats. So if you have that on your body, it's going to help you float. That is not going to help with your bone strength. Getting a DEXA scan is fine. Okay, it's fine. And I think that we interpret the DEXA scan incorrectly. A DEXA scan is a bone density scan, and it will tell you how strong your bones are. It can give you an idea about the density of your bones, but not the strength of your bones. That's where it falls short. So we'll get these DEXA scans, and we will be diagnosed with something called osteopenia or osteoporosis, and that can be damaging to you because the first thing that a doctor will think about is putting you on a medication. When one of the things that we can do is resistance training. Number 2, increase the protein in our diet. Most people who are in line and getting osteopenia, osteoporosis are protein malnourished. So they get protein energy wasting. So PEW, our bone strength is weak. We have sarcopenia. Sarcopenia, as we age, is more and more common. We end up not eating as much, our appetite is down, and protein is the most important thing. So if we are malnourished, we're going to take a hit as well. Increase protein, people. 4% of your bones is protein, not calcium. So the rest minerals, not all calcium. I said minerals. So if 40% is protein, it is in our best interest to increase amino acid intake. Beef and sheep and lamb, I would prefer meats. But if you want to add in poultry, that's great. If you want to add in some fish, that's great as well. Sure, I don't have any questions. So the two questions that came to mind yesterday that one didn't get a chance to answer, or two, I don't think I answered it completely. Brandy says, ever done research on methylene blue? I have not done research on methylene blue. I think a lot of naturopaths, even functional medicine doctors or providers are doing methylene blue in groups. What is the possibilities for methylene blue? I see methylene blue as an antimicrobial and improving mitochondrial function. Why do I do that? Because that's what the reading suggests. Again, studies on these things are lacking, as in any nutritional study, knocking it. But what is happening is we are doing studies of one. So these providers, or say it's myself, you might decide to go on methylene blue. And you could be a harbinger for microbial overload. Maybe it's viruses, maybe it's fungal infections, maybe it's bacterial infections. A lot of physicians or providers will add methylene blue. Where I think, first off, is before adding something, I like to take away. So what would have increased the risk of having microbials, whether it be viruses, fungal, what would have encouraged that? Parasites. If I think about what could encourage their growth, I want to take that away first. Is it sugar? Is it glucose? Is it iron? So I'm going to think in terms of taking something away first before putting you on. But methylene blue, I think it'll in time, I think we'll have more and more evidence because more and more providers are using it and more people are taking it. So if that is the case, then we're going to see, less microbial infections. But honestly, you could take the methylene blue, you increase your mitochondrial function, and you use it as an antimicrobial. However, if you continue to feed what is there could grow, we need to really stop having them live rent-free in our body by them. So before we dive into the methylenes of the world or the DMSO, which is very similar, it's an antimicrobial and also improves mitochondrial function. So DSMO and methylene blue, I think, are going to be up and coming subjects. Queen says, what do you think about high dose creatine cognitive function? I think there's some legitimate things going on. I can't say studies because, again, this is hard because what the alternative of giving high dose creatine was a detriment. And it's really not ethical to treat people with something that's never been studied. So if we put people on high dose creatine, what might be milligrams or 5 grams or 10 grams or 15 grams, high dose, well, what is high dose and who determines what high dose? These are difficult questions, but again, I think there are writers out there who are using high dose in terms of maybe 15, 20 milligrams, and then are noting improved cognitive functioning. Have I done any of these N of 1 studies? Brandy just adds in addition, for methylene blue, it is for problems with the mitochondria. Exactly. So, and it improves mitochondrial function, and mitochondria are found in all cells. So yes, I see, but how did the mitochondria get damaged in the first place? And we need to start with one, our diet, 2, are you on any other medications that can cause mitochondrial dysfunction? One of those being metformin for diabetes. It is a mitochondrial toxin. So should we try to get rid of the metformin by going with a low carb, no carb diet, because diabetes is a disease of or toxicity of carbohydrates? Randy, I'm not familiar with methylene blue being used with red light therapy. I know of and have looked into research on red light therapy, but I appreciate your addition. So thank you. Hello. Thanks for joining. All right, you guys. Oh, okay. Here's a question on thyroid. And this is good. This is review, you guys. When we have a physician who checks our thyroid, okay, because this was a question in regards to the ketogenic diet causing hypoglycemia, or can cause hypoglycemia, is because of the stress and raising cortisol. Okay, signs of an active thyroid. Since most doctors, don't want to lump everybody together. There are doctors out there who only check a TSH when checking their thyroid. And if your TSH falls within the reference range, they usually tell you, oh, you're fine, your thyroid's fine. In the meantime, patients are experiencing symptoms. It could be fatigue. It could be skin changes on my skin. It could be cold intolerance. It could be a slow pulse. It could be swelling. Myxedema is common, but swelling in your extremities, swelling in your face. These are the things that you have symptoms. You think you have a thyroid problem, yet the doctors only check TSH and telling you you are normal. I would encourage you to be a little more adamant with your physician and ask for a T3, a free T4, along with TSH. I would also suggest to get a reverse T3, And I would suggest getting a TG and a TPO. So there's 5 things: a free T3, a free T4, a reverse T3, a TG, and a TPO, along with the TSH. If those values are in reference range, then I could feel a little more confident telling you that your thyroid is fine and it's something else, and look somewhere else. A TSH above 2, in many instances, don't want to say paint with a broad brush, but a TSH over 2 is an increased risk of cancer. Okay? I think it's important to have a free T3, a free T4. The reverse T3 is needed as well. So let me kind of give you a generalized pathway of how the thyroid works. The thyroid is located in the neck. And remember, trauma to the neck, it doesn't have to be an antibody, or it doesn't have to be, but you could have a whiplash injury, or you could be in a car accident, a seatbelt came across your neck, you damage your thyroid. It doesn't, our thyroid doesn't necessarily always be the exposure of toxins that cause the thyroid. That's the main cause, but trauma or injury can also be a problem with hypothyroid. Now, our brain secretes TSH, thyroid stimulating hormone. Thyroid stimulating hormone, when it's elevated, this feedback, it tells the thyroid to produce T4. T4, 100% of the T4 is made in thyroid. That T4 is converted to T3 and reverse T3 in the periphery, not so much in the thyroid, but in the periphery. If you have conversion to reverse T3, that would tell me that you are too low of T3. On a cell, there are T receptors, and T3 activates those receptors. But if reverse T3 is too high, it actually attaches to the receptor with greater affinity. So regular T3 not attached there and function. When that happens, our T3 is not high enough. You could have symptoms, and if your doctor never look, they're it. U3 could actually look like it's in the reference range, but maybe on the lower end. So the doctor who knows about getting T4, but doesn't know about getting reverse T3, will assume that you again have normal thyroid and the reverse T3 actually elevated, just blocking the function of the functional T3. Makes sense? Now, you could have a normal TSH. You could feel like you have thyroid symptoms. You kind of feel crappy, or you do feel crappy. I think it's important to find out whether or not you have antibodies that are elevated in your body that are anti-thyroid, TGPO. Okay? Those two antibodies, if elevated, meaning they're present, is an indication that your body is inflamed. Now, one caveat, you start a carnivore diet, and you that carnivore diet for 3-4 months. Is that enough time to bring down those antibodies, to decrease the inflammation in order to bring down those thyroid antibodies? Maybe not. It could take upwards to a year to bring down those thyroid antibodies. So the doctor that keeps those thyroid antibodies, because they're maybe questioning your animal-based carnivore ketogenic diet. And your antibodies are still elevated, so it's not helping your thyroid. Well, but it's helping the person, they feel better. And again, the antibody is going to show correction on longer periods of time on an anti-inflammatory diet. So that's just one thing to keep in mind. I'm just trying to give you all the caveats. Now, a thyroid that is, let's just say, thyroid is functioning well, yet people are still having symptoms, we probably have to look elsewhere. And that elsewhere is iodine. We need to look, because most people are iodine deficient in modern times. Our soil is very depleted. We are consuming things that block the iodine receptor on the cells. Every cell in our body has iodine receptors. Thyroid cannot function with hormone production with iodine. Iodine is very important. Things that lower it is, one, fluoride. So if you're drinking fluoridated water or using fluoridated toothpaste, you will block the receptor. The fluoride will block the receptor that iodine attaches to. So fluoride and bromide and chloride have greater affinity for the iodine receptor than iodine. Those are all halides. You can look at the periodic table and look at them at the right-hand side of the periodic table and look at the halide. Iodine is very important. Bromide is in a lot of things. It's in our carpet, it's in our furniture, it's in our clothing. We are impacted by bromide every day. It's a flame retardant. Chloride is also prevalent. I just mentioned fluoride. It's in our water, drinking it every day. Okay. Those things to be aware of when we're looking at our thyroid. Another thing is maybe your pituitary gland is not functioning well. The pituitary gland in your brain. Remember, where in our brain is where TH is active and is supposed to be released T4 or T3 are low. That's negative feedback. So if T4 and T3 are low, it tells the brain, so this is negative feedback, it tells the brain, hey, we need some TSH to come down and stimulate. So if the brain area is not producing TSH, we have to the pituitary. What I initially is look at the calcium level on the complete metabolic profile. So if you BMP, look at the calcium level. One of my first things to look at is if that number is over 10, I want to look at the pituitary gland. What I get is a PTH intact, an intact PTH. So ask your doc to get a PTH. This sounds all complicated. This is why you guys are here. This is why you're gleaning information online, because maybe your doctor's doesn't have time or just doesn't have the capacity to think through all these things. There's a lot of patients, you guys, and don't have time. They're looking at, and a calcium level still at 10 or 10.1 inside the reference range. But if you're having symptoms, they're just saying you're fine. Really, you're not. You don't feel fine. Other things need to be looked into. And you, being smart listener, are going to help your doctor look at the extra things like the calcium level or an intact PTH or a reverse 3 or a TG or a TPO. A functional thyroid is very important if you are going ketogenic diet. Without a functional thyroid, you are not going to be able to get into ketosis. You will not be able to start burning ketones, to start burning fat. An underactive thyroid is a stressful thyroid. Stress hormones will be high. Blood sugar will be high. Insulin will be high. You cannot burn fat in the presence of insulin. Look at the thyroid. If a person maybe just decides on them, I'm going to go on a ketogenic diet, and all of a sudden they notice their labs, their thyroid tanked. The ketogenic diet does not cause the tanking of the thyroid. But what happened is the ketogenic diet unmasked an underlying problem with your thyroid, which is actually a blessing, because all along you were having symptoms of fatigue or slow pulse or feeling swelling, just not feeling skin, just not constipated, just not feeling well. And not until you went on a ketogenic diet did the surface, under the surface, go, oh my gosh, all along I knew I had a thyroid problem, and now it's very evident. It is opening, you guys. But what got you to the point where the thyroid was a problem? Your diet. So changing your diet is in the best interest. Sometimes I just leave these thyroids alone initially and see over a 3-month time period if the inflammation and the ketogenic diet helps that thyroid. Other times I have had to take over-the-counter glandulars in the form of thyroid glandulars, and got improvement. These are that you can do without your doctor, as you're checking. You can get your labs whenever you like. Yes, your insurance company may not pay for that, but it might be worth the trouble to pay for it on your own. Hook up with Extension Labs or yourlabs.com, ownyourlabs.com, or lifeextensionlab.com, or contact me. I have a lab, it's called Alta Labs, and I do get a discount. So, a discount full-time, whereas Life Extension Labs only gives a discount maybe 2 to 3 times a year. I don't know about discounts on Own Your Labs, but these are places if you want a TSH, a free T4, a free T, a reverse T3, TG, and a TPO, do it on your own and check and be your own doctor. I mean, your doctor really missed it in the place, so. Let's see. I'm just reading through the questions. Good morning, Lucy. Do you guys have questions on the right? So I am live right now on YouTube, Instagram. So if you have questions, put a Q in front of it, go from there. I talked about the thyroid being very susceptible, mostly to environmental toxins, some injury and trauma. The toxins are the halides, the bromides, fluorides. The thyroid can also be attacked by viruses or other antimicrobials. So a person who has yeast infections, a person who has mold, a moldy environment, those are also things we need to look into. Somebody mentioned that they had their thyroid out. That I don't think is going to solve all of your problems, because now you're going to be a lifelong customer of pharma company. What might be a better option is to, change your diet, avoid exposures to toxins and traumas. Again, it's up to you. So hard to make decisions or really good decisions without information. And those people who were told that they could just take thyroid out and not worry about it, or take their gallbladder out and not worry about it, those are sad situations. I mean, there are times when your gallbladder got so bad that was the only option. You might have had a leakage of their gallbladder because it got so inflamed, so it erupted. Again, there are times where you probably can't go back, but along the way, you probably had signs that your gallbladder was not healthy. You were having maybe some posterior right shoulder pain or right upper quad pain. About an hour or so after eating, you were getting signs your gallbladder wasn't working very well. When your gallbladder is not working very well, it's not contracting very well. It's a muscle, just like your biceps is a muscle. You work it in order for it to continue working for you. The only time it will work, so when you want to work your biceps, you put a weight in your hand. The only way to exercise the gallbladder muscle is to eat or consume fat. Then the gallbladder will see there's fat on board and release stored bile. Bile emulsifies that fat, breaks it down. If you are in a low-fat diet or eating crappy kinds of fats that don't stimulate the gallbladder, you risk that gallbladder becoming weak and floppy and flaccid, and it's still storing that bile. And what can happen when the gallbladder doesn't work or doesn't contract, that bile that's stored in there can get sludgy. It went from kind of a watery dirt to mud. And then when you do eat a fatty meal, that mud will squeeze out through the duct, and a common bile duct. And that it can be painful. You'll get a symptom of posterior right shoulder pain. You'll get a symptom of right upper quadrant pain. It's important to note, a lot of times we'll go to our doctor. Doctor will say, oh, that's on bladder. Good. Let's get an ultrasound of your right upper quadrant. Oh, I see gallstones, or I see inflammation, or I see whatever it is. Or they'll get a HIDA scan. They'll get some other scan. And they'll note that your gallbladder is, quote, unquote, not working. Well, it's not working. You never stimulated it to work. So they'll tell you that your gallbladder is permanently deficient in its ability to work. That is not true. You can get your gallbladder to work again. You just have to go at it slow. But the answer isn't just taking the gallbladder out. Okay, that would be in an emergency type situation. I would hope that you work at it first before taking it out. But again, it's up to you. This is just I don't think you should be told that it was an end deal. You know, if you have gallstones, it needs to come. That's not true. You have the ability to break those gallstones down. See, when the sludge sits there so long, they'll gallstones. That's what gallstones are. Patients heal themselves with over-the-counter on Amazon. They've healed their gallbladder past stones, broken them up and passed them. It's pretty cool. And these people did it on their own. They're very intuitive into their body. Necessarily need a doctor, but they wanted to run it by me after the fact. They didn't tell me to do it. So it was an after the fact. They told, guess what? Lucy says, so if you have a sluggish thyroid, could this be the reason someone is having a hard time burning fat? So that is one way of having inability to burn down fat. You have to also look at, your diet. And, in these instances with people like this, I would suggest looking, how do I want to rephrase this. I would look at the diet. I think there's a lot who might insist that they're on a carnivore or a ketogenic diet, but yet still have dairy. And dairy can also act as a deterrent for fat loss. Also, low muscle mass can be a deterrent. So that's I recommend, increasing resistance training. And I know you're already doing that, but maybe increasing the weight. So if we're not challenging our body, maybe it's time to, increase resistance, maybe get rid of the dairy and see if the fat burning creeps up or starts to improve. But yes, thyroid is another thing. And it seems right now, many people will just, if you can't lose weight, again, they haven't changed it, but they just go, I'm eating the exact same things as I did before, yet I can't lose weight. I used to be able to lose weight and now I can't. Yes, I would check thyroid. But two, I would ask them, is your muscle mass, at 40 as it was at 20? And the likelihood of that is pretty low. So the lack of muscle as we age, or sarcopenia, is also a contributor to not having an ability to burn fat. So question, I appreciate that. He says, so folks that don't eat much fat can have gallbladder issues. Yes, because that's the job of the gallbladder, is to sense whether or not fat on board. And its job is to secrete bile acid, bile salts. Those bile salts emulsify fat, break it down. So by eating fat, it's like doing resistance training, like doing weightlifting. So you eat fat, the gallbladder senses it, and it will contract. It works. If you don't eat fat, then that makes you more susceptible to gallbladder issues, whether it be sludge or flabiness or weakness or gallstones. Now you've increased your risk because you're on a low-fat diet. Then do eat a fatty meal, like you go out to eat with somebody and you decide, oh, you know what, I don't do this, then I'm just going to go have some, pizza or, buttered popcorn or whatever. You're going to eat some fat. And guess what? You're going to possibly get a bladder attack. Okay? Taking it out is not really the answer. But if you've already had it out and now you want to go on a ketogenic diet, now it's going to take some time. You have to go at it very, very slowly. All right? You have to go at it very slowly because you're not able to store bile in the gallbladder. It's gone. Your still produces bile. It just doesn't have a place to store it. So a person like this might want to consider eating smaller meals. So the liver and the intestine is still able to produce the bile, but it's almost Johnny on the spot. There is some speculation that you can get an outreaching of the common bile duct, and that can be, it can act like a little gallbladder, can store a little bit of bile, so bile salts. Then when you eat the fat, a little bit's stored instead of, hey, wait for my liver to make it or secrete it. Just eating small, frequent meals might be in your best interest with fat, and one big giant meal of cause what we call phantom gallbladder pain. Phantom gallbladder pain. I like these questions. Okay. Here's one. What is your experience with chronic fatigue syndrome? Not much. I don't have, I think in my 25 years of being a family practice physician, I might have seen 3 people. It's, these people don't necessarily come to a conventional doctor. They're seeing a functional doctor, seeing just basically a different doctor. And they are being tested for things really like Lyme. But I want to tell you that the person who has chronic fatigue syndrome, or, name for that is malaise or tiredness, well, the reason they're actually tired is because all of the energy is going to take care or to improve their immune system. And things that have brought their immune system down, when you talk to Lyme people, one of the biggest causes, when you talk to chronic fatigue syndrome people, one of the biggest causes of a microbial infection would be Lyme. And so they're in the process of treating the Lyme. They're on antibiotics, long-term antibiotics like Zithromax. Yet none of these people have ever been told to change their diet. Because what do microbials consume in order to live rent-free in your body? I'm not saying it's not Lyme, but I'm also saying it's not some virus or a bacteria or a fungus. Your immune system is down and all of your energy is going to try to repair the energy system. Yet you might be eating a crappy diet, meaning standard American diet. So you're eating a lot of saturated fatty acids. You're eating a lot of sugar. Those things feed microbial. There's another I have not mentioned is that I mentioned the iron thing. Our immune system, one of the reasons our immune system is poor is because of a lack of sulfur. I would venture to guess that many people are low in sulfur. It is hard for a doctor to figure this out, but sometimes we just need to assume, and we assume that you are not getting sulfur bonded amino acids. And this goes back to malnutrition. A person who's not eating enough protein is not going to get the sulfur bonded amino acids that they need. Sulfur is very important. It's important for an microbial. It's important that we consume protein and get enough protein, or else we're going to have problems with our immune system. We tend to think that we can just give a vaccine or sort of shot or some sort of jab, and that is going to improve our immune system. Many of our things that we call vaccines are not really vaccines. They are basically gene therapies. They're changes in our genes. It is my thought process, we should change the terrain. We need to improve the terrain by decreasing inflammation, by decreasing microbial overgrowth. How to do that? We need to stop feeding them. We need to increase ketones. Our body, our heart, our brain would prefer ketones, even when ketones are in the presence of sugar. How do I know this? Because there's been studies on people who keep the same diet, but yet added exogenous ketones. And they felt more alert, more energetic, more, everything. They just felt better just by adding ketones. Now, the ketones won't change the fact that you're insulin resistant. So you're eating a bunch of sugar, your insulin is elevated. Even though I give you ketones, you're not going to lose fat. You're not going to burn fat. Because remember what I told you. When blood sugar is high, when insulin is high, you can break down fat, not burn fat. You cannot break down fatty acids and make ketones. In the presence of insulin, you are burning blood sugar. You need to lower your blood sugar in order to lower insulin. Now you can start burning your fat, your body fat. Simply giving exogenous ketones is not going to have magnitude or any effect on whether or not you can burn fat. It might help your brain because it's going to prefer it. It might help your heart. The heart's going to prefer it. So should we take ketones? I mean, that again is up to you. My thought process again before adding something I do in my diet to change whether or not body's making ketones or not. And it's logical that I would simply stop carbohydrates. And within a week to 10 days, I'm in a ketogenic fat burning mode. And after 3 days of fasting, you probably have consumed of ketones. Once you pass that initial stage, not burning sugar as fuel, it's actually liberating. And people who have gone on a ketogenic diet will admit that once I got, over the withdrawal or over keto from withdrawing from sugar, I felt so much better. Okay. What things are anti-inflammatory and help with our immune system? Vitamin D, right? Vitamin D helps with our immune system. It's anti-inflammatory. Should we take vitamin D? Perhaps. Should we get exposed to sun? Yes. Should we lose body fat? Yes, but what does that have to do with body level? Well, vitamin D is fat soluble. So if you are a person who is overweight or obese, your vitamin D is trapped in your fat. No matter how much vitamin D you consume, it's not going to be absorbed because your fat is taking. Losing fat will actually help improve your vitamin D. It makes it more usable. Vitamin C. You need to take vitamin C. That's a good question. You could turn to YouTube and listen to a number of people, including a ketogenic provider. Even if the provider is in the belief the ketogenic diet is needed or is optimal, they might also consider vitamin C. In the same breath, they're going to consider it okay that you take a multivitamin. And when those two things are, I can't get on board with that thought process because, today I listened to a physician from, I think, Australia or the UK. I can't remember. She had maybe a British accent. It's hard. She talked about high dose vitamin C. I'm talking like 10 grams a day. In the same breath, she also suggested that people take a multivitamin because, and I get the process, is because our diets are so poor in vitamins and minerals that you might as well take this multivitamin. But if the person is on a ketogenic diet, they're eating plants, they are to be consuming plant toxins. And one of the plant toxins is oxalates. If you take a bunch of vitamin C, you are now going to not only absorb more of the oxalates from plants, but you are also going to encourage your body to make oxalates. And oxalates are harmful on our body. And if you take that in conjunction with a little bit of calcium, now you're going to make calcium oxalate. Oxalates love to bind to calcium, and they love to bind to magnesium. And so now you've made a perfect environment to get kidney stones. Now, maybe this doctor was only suggesting we do high dose where we have a microbial infection. Maybe it wasn't on an everyday basis. I hope it wasn't, because I don't think it's necessary. I think it could be harmful than it is good. Also, high dose vitamin C causes us to take in more iron in the form of heme iron is not really usable, about 3% of it. Heme iron is usable. Multivitamins have non-heme iron in them. All plants have non-iron. Animals have heme iron, with the exception of eggs, but eggs have non-heme iron, actually, you're aware. So if we are taking in a bunch of vitamin C, we're also going to be taking in high doses of iron from our food or synthetics, which you recommended a multivitamin, which I don't. If you feel that you are low on vitamins and minerals, or just minerals for that matter, maybe take a mineral supplement. Maybe get a better salt. If you are aware that you're eating foods with oxalates and you boil them or cook them in such a way that the oxalates are diminished, go for it. What about what about iodine? Should we be taking iodine? Iodine, again, we're all deficient. Okay, so back to the iodine. I was just reading a question at the same time. Back to I think we're all deficient. If you are eating some kelp or sea moss or something like that, you're going to get your iodine. I don't think that there is enough in iodized salt. In fact, the minute the salt is exposed to the air, it's going to dehydrate and the iodine will be lost. You would be best off just with some Lugol's iodine, although some providers are against that. They're more so in line with taking kelp or taking sea moss. If someone has gallstones and don't want to take anything for it, can these gallstones get dissolved with dietary changes? A lot of times they can. I've never experienced that, but I've heard anecdotal evidence that gallstones can break up. But again, I have no experience with that. Thanks for the question, Lucy. Good morning, Sheila. Thanks for being here. Chetan is going to a bunch of vitamins, vitamin A, retinol, vitamin C, niacin, vitamin D, calciferol, cholecalciferol, vitamin E, tocopherol, vitamin K, vitamin B6, pyridoxine, which is pyridoxine, B12. They meant cyanocobalamin. I would probably not do cyanocobalamin, methylcobalamin. A methylated B12 to be in your best interest. I don't think a cyanocobalamin of cyanide would be in your best interest. B3 niacin. Learned a few more in my, I don't know where. Let's just pull out one of these. This was interesting. Where did I read that? I'm trying to pull out. Where did I read that? It was in regards to B6. I'm trying to remember what I read. Okay, please don't quote me on this. When I want to just pull out this one on vitamin B6, and I think we leave vitamin B6. Jim, thanks for being here. I think we put vitamin B6 on the back burner. All right, and why do I say that is I don't think people they'll think about B12. They actually think about B3, which is niacin. They know it's B3, but they think about niacin all the time, or niacinamide. And B6 always gets left on the back burner. Pyridoxine. If a person is consuming a plant-based diet, they are likely not getting enough pyridoxine, B6. A good amount of B6 is found in animal products. Why do we need B6? We cannot make glutathione without B6. And if our diet is low in B6, that leaves it to you taking it. And whenever we take a synthetic vitamin, and our natural endogenous production of anything, but in this case, glutathione is hampered. It's not good. In fact, it could decrease our natural production of glutathione. I don't completely know the ins and outs of that, but why do we need glutathione? It's a master antioxidant. So if we want a fresh and upcoming immune system, we need to provide it with the vitamins and minerals that are needed. Another caveat to a plant-based diet, if they said they got B6 or B12 in the diet, their likelihood of absorbing it is lower because of the plant toxins. The plant toxins being oxalates and phytates and tannins. All of those are plant toxins which decrease the absorption of B vitamin, decrease the absorption of calcium and magnesium and zinc and selenium, amino acids. All of those are diminished whenever you consume plants. Now, a plant-based person will get around that boiling their food, not eating them raw, basically cooking plants. Now you've decreased some of the oxalates, but maybe not. So the dosing that they will need to compensate for the anti-nutrient and the lack of quality nutrients in plants would be take a supplement. Mom asks, do you recommend DNA testing to determine what your body needs to structure supplement program? I can't answer that for you. Nam would be something that you would want to do for yourself and decide. But the question is, if you are low on some particular supplement, instead of just taking the supplement, so doing a DNA test and say, hey, you're low in magnesium. Well, why are you low in magnesium? Are you going to continue doing what made you low in magnesium? and then just simply take a supplement, to me, it's like a waste of money, especially initially. You could change your diet. You could improve. You could eat a whole food ketogenic diet, which maybe you are. I don't want to assume anything. And then you've done that 6, 9 months, maybe a year. Hey, you know what? I want to see what my status is. Then you might to levels. Getting a DNA test, that's a good question. Particularly I want to keep my DNA to myself, and that has to be, something that you do on your own and for your own good. So you gather enough information and you make a good decision for you, whether or not I would do a DNA test or not a DNA test, shouldn't matter to what you feel about, okay? My thoughts on it. If you want, you could check if it's magnesium you're looking at. You can see magnesium level. There's other ways of checking, your vitamins and minerals in maybe not DNA. I don't know. I don't know enough about it to tell you one way or another. Okay. Tamil brings up a question about fibroids, and this kind of goes back to my thought process of what develops a fibroid. Fibroids are basically tumors, and a tumor walls itself because of a toxin. Some schools of thought say it's of iodine. Anywhere you developed a tumor, a collection of growth, that growth is actually desperate. So let me give you an example. A thyroid nodule. Some schools of thought would say to you that because you have a thyroid nodule, it's growing because it's seeking out, it's trying to develop more tissue to seek out more iodine, to steal more iodine. It's a sign that the iodine is low. These same doctors extrapolate that iodine seeking behavior as a fibrocystic breast change, so fibrocystic tumors in your breast, or a fibroid. They will extrapolate that and say, hey, you're getting these tumors, these growths, because you're low in iodine. The minute, and I have seen this, the minute you start supplementing these with iodine, especially if let's say they got fibrocystic breast disease. If you take away, which comes first, you take away the caffeine and you take away the sugar and you add iodine, everything gets better. Or you keep your diet the same, you add iodine, and the condition gets better. Iodine. There are schools of thought that it's iron. Iron has built up in tumors and is causing reactions, free radicals. I don't exactly know. Could it be a combination of both? I would feel better saying that, that it's a combination. I don't like to be a reductionist and say, it's all just iodine. If you take iodine, the fibroid will go away, the fibrocystic breast change will go away, the thyroid not go away, and then maybe they don't. Cleaning up in all over the body is important, and that cleanup includes cleaning up non-transferrin bound labile iron. It's bound, this iron that's loosey-goosey, that heme iron is destroying our cells. It's rusting your body. And, a functional medicine believes that as well. They do believe that we have iron in our that's building up and it's causing problems. But their first, the thing that they jump to away is something like a chelating agent, EDTA. Even give it in IVs. You'll get EDTA in the IV. I'm not telling you that this is the right or the wrong thing to do. Again, instead of changing diet, you continuously consume forms of non-heme iron, whether through cast iron pans, synthetic vitamins. So the consumption of non-heme iron is still building up. If you chelate, you are binding it and usually urinating it out. But what if you can't chelate it? There's other ability to EDTA also does not sequester. So now you're looking at a condition where you might only be chelating if you can do that. This is where all the heavy metals that are in our atmosphere, in our foods, in the soil that we're consuming, and we rely on our liver, but these heavy metals are basically destroying our body. And sometimes we actually take in more heavy metals because our body is sick because it's low on something else. Yes, Nam, cast iron pan can be a problem. They can leach non-iron into our body. We can take in more non-heme iron. And the reason we take these heavy metals is because sometimes we're on something else like zinc or selenium. And so back to that question about, if you check all these things, these DNA, you could get rid of all the heavy metals, but you're on something else, right, Nam? That you're low on zinc or you're low on selenium. So if you were to take the zinc or the selenium, then you wouldn't attract the heavy metals as much. It's all possible. I don't know the exact answer. I'm just trying to spur your brain to think, okay? And one of the, if we reduce everything to, like we're talking about the fibroids, the question on YouTube, if we reduce it all down, providers telling me if it's all iodine, do the iodine and see if it gets better. You could turn to the second school of thought and say, these fibroids, it's from over of non-heme iron. Okay. Are you simply just going to do a chelating agent and try to get rid of metals with EDTA, knowing that you're not going to get it all? And in fact, if you don't know the sources of non-heme iron, you're going to continue to consume. So you need to remove them and at the same time clean up. Allison says, ugh, I thought cast iron pan was better. What are we supposed to cook with? Oh, Allison, I go back and forth on this. Yes, I used the cast iron pan. I did. I stopped because I take an interest in learning non-heme iron versus heme iron. I do take an interest. One of my only interests is just an interest. Okay, so I switched from a cast iron pan. A short period of time, and it was lovely, very lovely. I used an earth pan. It was like a clay pot. It was amazing, but it has to be treated in such a way so it won't. And over time, mine started leaking. The juices, the grease, the natural fats that were in the meats I only cooked meats, right? So I was only these meats, and then the porousness of the clay pot allowed the oils, the grease, the natural fats to seep through. Guess what? Now you're at risk of a house fire. So I got rid of that. What do I use now? Stainless steel. I use stainless steel. Good. Break your bubble. Again, you'll be able to get a cast iron pan that is more and more quality. I don't know, but how do you know? Do you use the? I've had people who use their cast iron pan, got their levels checked for iron, got rid of the pan. 4 months later, that was the only thing they checked, Allison. That was the only thing they checked. And guess what? Iron levels got better. That is the anecdotal evidence I have. Leaching non-heme iron. Who knows? Eating a ton of plants and taking synthetic vitamins as well. I mean, who knows? But back to the doctor who promotes taking. Good morning, Dr. Christie. Back to the doctor that was promoting taking the vitamin C. I get where she's at. And maybe, again, maybe I took her comments out of context and she's talking about an acute infection. Take ketone, take vitamin D, take vitamin C, take iodine. Okay. Maybe she even mentioned take methylene and DMSO. Okay. Maybe because they're inflammatory and antimicrobial and it was just a period of time. Because you wouldn't necessarily take an antibiotic every single day. You only take it for 7 to 10 days and then you're off of it. Why would you be taking any methylene blue all the time? Or why would you be taking DMSO all the time? I don't see that reason. Okay. So for this particular doctor that I was listening to this morning, the amount of information that I get from I'm not even going to names, but the amount of information that I get from these doctors online, I set it all up. And then I will contrast and compare to other things that I'm learning. Okay. I will find out that, hey, maybe I shouldn't be taking a whole lot of vitamin C because it's increasing my storage capacity of things that I don't store, like non-heme iron. Okay. I don't want any more non-heme iron rusting cells from the inside out. I do not want to age rapidly inside out. I also don't want to consume sugar. It's going to increase glycation in my body. Sugar binds with proteins all over your body. I particularly don't want collagen and my elastin in my skin to be glycated on a regular basis by consuming sugar. That's called wrinkles and aging, crinkly, crepey, yucky skin. So if I avoid sugar, I'm not going to get as glycation. Sugar binds to protein. For this reason, if I avoid taking in more heavy metals, sometimes that's hard. It's hard not to breathe in the air, okay? But if you get rid of your castan, if you stop eating plants that are high and fortified with non-heme iron, that is a win. Now you got to figure out how are you going to dispose of the non-heme iron that has built up for years, because simply going to an animal-based diet is not the answer. An animal-based diet will prevent further accumulations, but it's not going to get rid of what you got going on. Neither can EDTA. Because the EDTA is only chelating and removing things in your urine. Could it get all of the iron? I don't know. Can it get all the mercury and the arsenic and the and the fluoride and all of the other heavy lead? Can it get those heavy metals that are in our dirt? Another reason why I don't eat plants is because those are direct source to the dirt that we're eating. The soil is contaminated. I will eat plants as long as I'm through a cow, okay, animal. That's the only way I'm going to eat it. I don't know. Am I maybe I'm just something I do. Okay. Same reason I'm not going to eat sugar. And so if I'm looking at how to clean myself out, I got to avoid sugar. At least sugar doesn't build up in my system. Okay. In 3 days, gone. I only get a certain amount, 5 grams made in my liver on a continuous basis. Unless I eat a little bit of lactose in my cheese or my heavy cream or something like that. Then I'm going to get a little more. Maybe I'm at 10 grams instead of 5. Overly consuming that and causing glycation, not going to do it. Using non-heme iron sources of consuming it, like the pan, the vitamins, or the plants, not going to do it. Dr. Christie says ETA causes adrenaline to adrenochrome reaction in the presence of iron. Oof, that is deep, Dr. Christie. You and I might have to talk more about that because I don't. Wow. I mean, the only time I wide-eyed when I think of adrenochrome, but and I can talk more about that. I'm not sure even how to explain that to the people. But Again, it kind of goes back to the fact that EPA might not be the end all be all, because again, it is only a chelating agent. It's not going to bind, it's not going to sequester. Okay. I'm not saying that it's a good thing or a bad thing, but Dr. Christie seems to think that it's got more negatives than it does positives. And we need to weigh the risk benefit ratio. And I hear doctors talking all the time that, you know what, the risks are not as bad as the benefits. Is that because you said so? Is that because your belief? Or did you ask me? I want to know the actual risk of doing something. For instance, and I always give this example because I feel very confident, okay? Statins. Hey, go lay down. Sorry, they're getting a little antsy. If I take a statin, I want to know the risks of that. The risks of taking a statin is that particular medication, like medications, block a normal pathway in our body, a normal biologic pathway in our body. And at the end of that pathway is cholesterol. But in the process, we're also making vitamin K. We're also making CoQ10. And those things are needed. So whenever we give something as a doctor, we have to know what are the ramifications. Simply saying to the patient, the risks do not outweigh the benefits. The risk of having a heart attack is much worse than not having vitamin K, Q10. Well, doctor, can you explain why I would need vitamin K and why I would need CoQ10? As far as I'm concerned, you're relying on the fact that I need to lower my cholesterol. And you're also telling me in the same breath that I don't need the benefits of cholesterol, which is making the membrane of every cell, making hormones, including your sex hormones, being a component of your brain, 40%. So you're telling me that the benefit of not having a heart attack, I think, is caused by cholesterol, outweighs the ramifications of taking this medication and not having vitamin D. My immune system sucks. Not having vitamin K. I have buildup of calcium, which obviously can lead to plaque. And I'm not having cholesterol, which I need for hormone production, immune system, basic cleanup in my body, brain function, cell structure. I mean, if I don't have cholesterol, don't I fall like a heap on the floor? So the lower matters. Still, you believe that. Dr. says it's a quote maybe, or a study that was done maybe in the 50s. So yeah, send it, show it to me. Nam asks, what do I think, or what about intermittent fasting? And you can go both ways on this. That as we age, especially female, I say this because naturally women have low muscle mass. If you are doing too much fasting, it's possible to incur sarcopenia, meaning low muscle mass. I don't want you to do that, Nam. Your intermittent fasting might look like an 18-6. Do I think that's okay? You fast for 18 hours and you eat in a 6-hour period? Yes. What people are doing, especially as we get older and our plate is not that great, it depends on what we're eating. We will go through fasting states, and if we're doing that on a regular basis, it's possible we're not taking in enough protein. Protein for our bones, protein for our muscles. Oh, jeez. Yep, she was getting antsy, and guess what she just did? She urinated on the rug. I watched it. She looked at me. She said, I told you I had to go. So this is my fault. Girls. All right, so back to the fasting. Fasting can be good, can be bad. Would I recommend doing it on a regular basis? I can't go both. I can't recommend it or not recommend it. Do you feel good? Are you still able to make muscle? Is your bone strength good? We need protein. Remember, 40% of our bone is made of protein. So just be careful. Know your body. Watch it. Nutrients. Do not malnourish yourself. There's positives to fasting. Ketones, cleanup in your body, going into autophagy. Awesome thinking. Okay? We need autophagy. You need maid service. If you're in a hotel room for a week and you get maid service, they come in and they clean things out. Fasting. But maybe you only need 18 hours. Maybe you only need 4 hours. Maybe you only need that once or twice a week. But extended fast, just be careful. Just be careful. All right. You guys over YouTube, I can see you're just chit-chatting away over there. All right. Are there any more? We went through a lot today. We started out talking about hypoglycemia. We were talking about hypothyroid. We talked a lot about iodine. We talked about supplements. We talked a lot about supplements. We talked about muscle building. We talked about bones. We talked about methylene blue, DMSO. We talked a little bit about heavy metal toxicity, about chelating. We talked about sequestering. We talked about binding. There's a lot we talked about today. And we ended just recently, we talked about fasting. And yeah, it makes sense when we think about it. So we just need to, hi, thanks for being here. So if there's not any other questions, let me make sure. Oh, here's a question that just came in from Mary. What is your take on grounding sheets and mats? I think grounding is a part of nature and I believe in it. I believe getting as close to the ground as possible, barefoot, skin exposed around as much as possible for the transfer of electrons to basically detox. I think getting rid of some of the things that we have going on in us can be improved by being outside in nature and getting rid of our rubber-soled shoes and our socks and having contact with the ground is important. Can a mat sheets take that place? That's tough because here's what I believe those sheets or those grounding mats are in, right, to electricity. Am I correct in saying that? Is that correct? They are plugged in to an outlet. And if that's the case, are we getting some EMF through that electrical outlet? Like if a person doesn't have the ability to put blockers on that particular whole house, are we taking in some of that? Then we're plugging it in, then we're sleeping on it all night. I mean, isn't that just like putting our phone right beside our head when we're sleeping? I don't know. I don't know enough. Do you have to get a plug in? So Jerry, the ground only. At this point, I agree with that. I mean, there was a story of somebody who had a grounding mat and then they wired copper to it and then they put the copper outside their window and wired it into, buried it into the ground. There are anecdotal stories of people who around their plants, that they grow in their garden, they will wrap copper around it and into the ground and watch plants come to life. There's some pretty stories out there. It's not something that I have ever dug into. Brett says, I want to get some Wi-Fi blocking paint. Yeah, I mean, there are people out there on the internet. I've watched these, what what do you call preppers that will actually paint their roof with this, I mean, their whole house actually with this black paint that blocks everything, really. I mean, could you imagine if your neighbor down the street, their whole house and roof black with the special paint? Smiley, hey there, Smiley. I may or may not be able to answer off the topic question, but go ahead. We were just getting ready to magnetic field of the earth, I think, ground. I don't know what you're asking. Are you asking me a question, or are you asking me about? Okay, Smiley is chronic kidney disease stage 3. Okay. Yes, Mr. 9, I would agree with that. How serious is it? Well, instead of asking about the seriousness of it, why don't you ask, can it be reversed? Can you reverse chronic kidney disease stage 3? And the answer is yes. So is it serious? Yes, especially if you allow it to progress to stage 4 and stage 5. That's how serious it is. But instead, why don't you be positive and say, can it be reversed? Yes. You're welcome, Smiley. Thank you, Mr. 9. I appreciate that. God bless you as well. Okay. I believe that is the question. We do every Saturday and Sunday. We live, and we do that at 9 a.m. Central on Saturday, 10 a.m. 10 a.m. on Sunday. And I love to hear where you guys are listening from. And it looks like that Buffalo, New York. That's awesome. Yes, Smiley, it just in time. It takes, while we're just I think it's important to ask your doctor for a cystatin. Simply looking at your creatinine, your BUN, and an estimated GFR, EG, and what stage you're in is the eGFR. Your GFR, creatinine, and BUN will not be as accurate as if we check a cystatin C with an eGFR. So Diane listening from San Diego. Great. Thank you for commenting. I appreciate that. So if you are really, really super interested in your kidney function, especially if you got stage 4, remember anything less than 60 starts stage 2. You are already at stage 2 kidney disease. And what is interesting is that your reference range, a lot of times it will say it'll just say greater than 60. Now, I want your levels to be 90, 100. If it just says greater than 60, that could be 61. You're basically in stage 2 chronic kidney disease already, and nobody mentioned anything to you. And they're not going to mention it to you until you're 54 or 44. Yeah, a 60 eGFR is stage 2. Your goal is to be above 90. Now, if the reference says greater than 90, I would feel more confident. Maybe it's 91, it's 92, maybe it's 102. I would feel better about getting an eGFR and it said greater than 90 than greater than 60. Because I always err of, oh my gosh, that's pretty bad. 61. Greater than 60 could be 100, and it could be 61. Get a statin C. It's more accurate, is final say on it. A statin C. Any other questions, you guys? All right. So you guys have a very blessed Sunday. Lord willing, we'll be back on Saturday. If you are not already subscribed on YouTube, please hit the subscription button, hit the thumbs up, do the clickety-clack and liking and all that stuff. And share it with who you think might find this interesting, okay? You guys have a great rest of your. See ya.